Welcome back to Family Health Today. I'm Dr. Janette Nesheiwat. Pancreatic cancer is the fourth leading cause of cancer-related death in the United States. Despite this, however, it is rarely talked about in the media. Recently, the death of a famous actor, Patrick Swayze, due to this disease has brought more attention to it. And despite its relative obscurity in the public mind, pancreatic cancer is a very serious and dangerous form of cancer. Well, joining us now to discuss pancreatic cancer, its treatment, and the resources available to support those who suffer from it is Dana Quin, a member of the Pancreatic Cancer Action Support Group and an activist in trying to fight this disease. Welcome, Dana.
Hi, thanks for having me.
Tell us, what is pancreatic cancer? Tell us about it.
Well, as you mentioned, pancreatic cancer is the fourth leading cause of cancer deaths in the United States, and the 5-year survival rate is less than 6%. Despite these statistics, pancreatic cancer receives only 2% of the National Cancer Institute's budget. It is the only cancer that hasn't seen improvement in its survival rate in over 40 years.
That is a staggering number. What are some of the signs and symptoms that someone who has pancreatic cancer that we will first see?
Some of the symptoms can include abdominal and back pain, digestive issues, and unexplained weight loss, which can sometimes mean other things that you may not think of pancreatic cancer. The most common symptom that triggers a diagnosis is jaundice, which is yellowing of the eyes and skin.
Dana, how did you become involved in this network?
I became involved last June after my dad was diagnosed with stage 4 pancreatic cancer. After learning the deadly statistics associated with pancreatic cancer and how underfunded the cancer is, it became my passion to be an advocate for my dad.
Well, thank you. Do you find that as an advocate and volunteer with the Pancreatic Action Network that you receive a lot of people calling and contacting and trying to get more information and support from this network?
Yes, I think as more people become aware of the organization and know of the services that they offer to their patients, more people will start contacting the organization.
And from your experience and what you know, who is at risk for pancreatic cancer?
As we know, 30% of the cases are linked to smoking, with 10% having a hereditary link. We also know that the incidence among the African American community is at a 50 to 90% high risk category, the highest of any ethnic group in the United States.
Wow. What treatment options are available to those who have just been diagnosed with pancreatic cancer?
The most standard treatment is chemotherapy and/or radiation. Some patients will be eligible for a procedure called the Whipple. It is also encouraged that patients seek out information regarding clinical trials while exploring treatment options, and they can also contact our organization, the Pancreatic Cancer Action Network, to find the most current information about clinical trials around the United States.
Sure. Now, I've just learned, unfortunately, about a patient who was only 34 years old diagnosed with pancreatic cancer. This is something that can affect anyone, any age group. Is that correct from your experience?
Yes, it is.
Is it hard to detect pancreatic cancer?
It is. And the reason why is because of the location of the pancreas. The pancreas is located deep in the abdomen, and unfortunately, there are no early detection methods like there are for breast, colon, and prostate cancer.
Is there anything anyone can do to help prevent pancreatic cancer?
There is little known as to how we can prevent it, and as I mentioned earlier, 30% of the cases are linked to smoking. However, families affected by pancreatic cancer can contact our organization to learn more about the disease and preventative measures.
Do you think pancreatic cancer research is underfunded? And if so, why?
It is, and sadly, it's because of the high mortality rate with pancreatic cancer. There are few survivors to advocate for the cause, and many times it's the family and friends that will continue on the fight for their loved one.
Sure. What kind of support does the Pancreatic Cancer Action Support provide and offer?
The Pancreatic Cancer Action Network provides a program called the Patient and Liaison Service, also known as PALS, and this service provides the most current information ranging from diet and nutrition, clinical trials, treatment options, and pain management. It also has a program that can connect patients with caregiver support and survivor support, so they can share those experiences with people who also have had those experiences.
Absolutely. What is the goal of this network?
The goal of this network is to double the survival rate by the year 2020. We feel it is our responsibility as the leader in the fight against pancreatic cancer to set a goal and create a timeline so that everyone is working towards the same objective in fighting pancreatic cancer.
What do you recommend, Dana, for someone that just hasn't been feeling well, losing weight, and some of the symptoms that you mentioned earlier? Do you recommend don't hold off on getting treatment, go see your doctor?
Absolutely,
that sort of thing?
yes. Speak to your doctor right away with if you're experiencing any of those symptoms, and begin that dialogue with your doctor.
Because early treatment sometimes can help with the outcome and the prognosis. Is that correct?
Correct.
Yeah. How can people get involved with your network, the Pancreatic Action Cancer Network?
Oh, there's many ways that people can become involved with our organization, ranging from participating in a fundraiser, making a donation, or volunteering on a local level. However, next Tuesday on June 14th, people can participate in National Call-In Day, which is going to help raise awareness for the Pancreatic Cancer Research and Education Act that is currently being introduced to Congress.
Very good. Now, I know we talked about earlier how pancreatic cancer research is underfunded. It's not receiving a lot of attention, and up until really recently, celebrities such as Patrick Swayze. How do you think that media attention is helping bring more attention to pancreatic cancer and research in a positive way?
Yes, the media attention is going to help raise awareness, increase funding, and ultimately help us work towards finding a cure for the disease.
Do you have any advice or words of wisdom for our viewers, Dana, as far as if they suspect or they want to get involved? Maybe perhaps pancreatic cancer runs in the family. Do you think they should go and get checked out?
Well, unfortunately, there aren't any tests at this moment to be able to find out if they do have it. But what I suggest is, once they are diagnosed, to reach out to the Pancreatic Cancer Action Network and to get the support that they offer free to patients and their family.
Very good. And that's pancan.org. Is that the website?
Yes, www.pancan.org.
Okay, very good. Well, thank you so much for joining us, Dana. We appreciate it.
Thank you.
All right. Stay tuned. Family Health Today will return in just a moment.